is how to use your Byetta pen. Please watch this video from start to finish on how to set up and use a new pen. Then rewind the video and learn step by step how to set up the pen and give yourself an injection. Pause the video after each step so you can read the written instructions in the Byetta user manual. Remember, you must eat within an hour after taking your morning and evening dose of Byetta. Give yourself an injection only if you are going to be eating within the next hour. Pen needles are not included with your Byetta pen. Ask your healthcare professional which needle length and gauge is best for you.
It's helpful if you have your Byetta pen user manual handy as you go through the injection steps. The following instructions will be given with the pen's needle end facing to your left, like the patient is currently holding the pen.
Setting up the pen.
Each time you receive a new Byetta pen with a full 30 days of doses, you will have to set it up. Setup is only done the first time you use a new pen. Check the pen label before each use to make sure it is the Byetta pen your doctor prescribed to you. Pull off the blue pen cap. Check the Byetta in the cartridge to ensure the liquid is clear, colorless, and free of particles. If it is not, do not use the pen. Please note that you may see a small air bubble in the cartridge. This is normal. The next step is attaching the pen needle. Remove the paper tab from the outer needle shield. Push capped needle straight onto the pen and screw the needle on by turning it towards you until the needle is secure. Pull off the plastic outer needle shield, but do not throw it away. You will need it later. Then pull off the small plastic inner needle shield and throw it away. Check that the arrow is in the dose window. It should be pointing to your right. If there is no arrow in the window, turn the dose knob on the end of the pen away from you until it stops. You'll feel the dose knob click into place, and you'll see an arrow pointing to your right in the dose window. The arrow helps show you what to do next. Pull the dose knob out until it stops, and you see an arrow pointing away from you in the dose window. Then turn the dose knob away from you again until it stops and you see a number in the dose window. Depending on the dose your healthcare professional prescribed, the number will be either a 5 or a 10. Whatever number you see is the correct dose. You cannot dial the wrong dose because your Byetta pen can only deliver your prescribed dose. Each time you receive a new Byetta pen with a full 30 days of doses, you will have to set it up. Setup is only done the first time you use a new pen. With the needle pointing up and away from you, use your thumb to firmly push the injection button until it stops, and hold the button while you slowly count to 5. If some Byetta does not come out of the tip of the needle, repeat the setup again with the same needle up to 3 more times. If some Byetta still does not come out, please refer to the questions and answers section of the user manual included in your Byetta pen box. You should now see a triangle pointing away from you in the dosing window, which means your pen is ready to reset. Turn the dose knob away from you until it stops and you see an arrow pointing to the right in the dosing window. If you cannot turn the dose knob away from you to see the arrow, please refer to the questions and answers section of the user manual included in your Byetta pen box. You have now completed the new pen setup. You do not have to do this again until you get a new Byetta pen at your next refill in 30 days. Your Byetta pen is now ready to use.
Injecting Byetta.
Once you have successfully completed the setup and have seen some Byetta come out of the tip of the needle, you are ready to give yourself an injection. Check the pen label before each use to make sure it is your Byetta pen. Check the Byetta in the cartridge to make sure the liquid is clear, colorless, and free of particles. If it is not, do not use the pen. Please note that you may see a small air bubble in the cartridge. This will not affect your dose. Check that the arrow is in the dose window. It should be pointing to your right. If there is no arrow in the window, turn the dose knob on the end of the pen away from you until it stops and you see an arrow pointing to your right in the dose window. The arrow helps show you what to do next. Pull the dose knob out until it stops and you see an arrow pointing away from you in the dose window. Then turn the dose knob away from you again until it stops. You will feel the dose knob click into place and you will see a number in the dose window. Depending on the pen your doctor prescribed, the number will be either a 5 or a 10. Whatever number you see is the correct number. You cannot dial the wrong dose because your Byetta pen can only deliver your prescribed dose. If you cannot turn the dose knob away from you to see the number, please refer to the questions and answers section of the user manual included in your Byetta pen box. Hold the pen with your thumb over the injection button and insert the needle into the skin using the injection technique recommended by your healthcare professional. Use your thumb to firmly push the injection button until it stops. Then hold the injection button in while you slowly count to 5. This ensures you get the full dose of Byetta. Then remove the needle from your skin. If you see drops after removing the needle from your skin, refer to the questions and answers section of the user manual that comes with your Byetta pen. When the injection is complete, you should see a triangle pointing away from you in the dosing window. You are now done with the injection. Now you're ready to reset the pen. To reset, turn the dose knob away from you until it stops and you see an arrow pointing to your right in the dosing window. If you cannot turn the dose knob, your full dose has not been delivered. Please refer to question 7 in the questions and answers section of the user manual included in your Byetta pen box. You should now dispose of the needle. First, carefully replace the outer needle shield. Unscrew the needle by turning it away from you until the needle is detached from the pen. Then, dispose of the needle as recommended by your healthcare professional. Make sure to remove the needle from the pen after each injection. Pen needles are not included with your Byetta pen. Ask your healthcare professional which needle length and gauge is best for you. After the injection, you should eat sometime within the next hour. You could eat immediately after you give yourself a shot or up to an hour later. So for example, if you give yourself the morning injection at 8 a.m., you should eat breakfast anytime between 8 and 9 a.m. Another example would be if you give yourself the morning injection at 9:15 a.m., you should eat breakfast anytime between 9:15 and 10:15 a.m. Byetta should be taken before the morning and evening meals. Byetta should not be taken after a meal. If you forget to take the Byetta injection before a meal, do not inject that Byetta dose after the meal. That dose should be skipped and the next dose should be taken as scheduled. So if you miss your morning dose, take the evening dose as scheduled and resume your normal schedule the next day. Prior to first use, store your unused Byetta pen in the original carton in a refrigerator between 36 to 46 degrees Fahrenheit. After first use, your Byetta pen can be kept at room temperature, not to exceed 77 degrees Fahrenheit. Do not freeze. Do not use Byetta if it has been frozen. Byetta should be protected from light. When storing Byetta, it's important that the needle is not attached, since some Byetta could leak from the pen or air bubbles could form in the cartridge. Byetta pens should be thrown away 30 days after their first use, even if there is still Byetta inside. The Byetta pen should not be used after the expiration date printed on the label, and never throw your pen away with the needle attached. Like other medicines, Byetta should be kept out of the reach of children. Of course, you can travel with Byetta. It's convenient. Just keep the pen at a temperature not to exceed 77 degrees Fahrenheit.